and health tech platform Visit Health. They've raised over 250 crores. It's a combination of primary capital and secondary purchase. And we've got Vaibhav Singh, who's a co-founder and MD at Visit Health, joining in. Thanks so much for taking time out. Just tell us a little bit more about this fund use.
Sure. So we have raised close to 270 CR, and the reason of this fundraise was to enhance our servicing capability and invest more in the people and the technology, which we believe will be very much useful for bringing our service efficiency quite up in the system. So that's the reason for our fundraise.
Right. And what about the remainder acquisition of shares? How is that really going to work? You did a good chunk of the ESOP buyback as well. Give more details.
That's right. So this fundraise is a combination of primary and secondary transactions. So we have done close to a 15 CR ESOP buyback in this round. So then this is the second ESOP buyback we have done in the last 2.5 years.
So how many companies are you serving at present? How many small businesses do you serve? How do you plan to grow that number?
Right. So we are currently working with close to 430 million large corporates who are using our platform for offering OPD and wellness solutions to their employees, and close to we work with 5,500 plus SMEs who have deployed our platform for the same intention of offering primary healthcare services. And apart from that, we work with close to 18 insurers, combination of life, general, and standalone health insurers who are also using our cashless services and offering it to their end policyholders. And the idea is with this current funding, we want to expand our entire network. The more and more cashless network, it should reach tier 3, tier 4, tier 5 cities. And to enable, to minimize the reimbursement and to enhance the cashless services. So to do that, we need a lot of folks on ground who will be setting up the network in remote areas. So we'll be in a better position to even go and service tier 3, tier 4 cities. So that's the agenda.
And I think you have a CAGR of about 110% over the last 8 years. What is going to drive growth in the coming years? How do you foresee it?
So over the last 7, 8 years since we started, we are seeing on an average of 110 CAGR, and we believe that this is going to continue. And while the scale has shot up quite drastically, but at least for the next 3.5, 4 years, we are anticipating a similar CAGR. And with the new partnership also with Tatva Care, where our services have been enhanced, so we are in a much better position to now cater to a larger demand.
Sure, and finally, leave us with your long-term game plan.
So from a financial perspective, as I mentioned, we are growing close to 110 and an average of 110 CAGR, and we'll be touching close to 300 CR ARR in the next couple of months. And the idea is to grow close to 3.5x from now in the next 2 years. That's the anticipated business plan which we have.
Thanks for joining in.